And I'll start by just introducing myself. My name is Natalie Boivin. I am so glad to have you here with us. My co-host today is Janet Gunderson, who is in
Hello.
Battleford, Saskatchewan. Hi, Janet. And I am speaking to you from Ottawa, Ontario. And we would like to know where you all are from, and if you can drop your name and where you are from in the chat box at the bottom of your screen, that would be great. Firstly, I would like to acknowledge that being in Ottawa, I am on the unceded, unsurrendered Algonquin Anishinaabe territory. Janet in Saskatchewan will be speaking from Treaty 6 land, homeland of the Cree, Saulteaux, Stoney, Dakota, and Métis nations. And we recognize that this history is important to our future, and we honor the elders and knowledge keepers, and we pay our respects to the caretakers of these lands. Now, how do we find ourselves here today? Well, Janet and I met through CAPA, and she will speak more on CAPA later. It's a Canadian Arthritis Patient Alliance. And we were speaking with Lori Prue, Managing Director of CAPA, and basically Lori mentioned maybe doing something for Rare Disease Day. And as you all may know, 1 in 12 Canadians suffer with a rare disorder. So it is something that a lot of us suffer with. And we wanted to give rare disease patients a safe place to listen to and maybe share each other's stories, challenges, concerns, even helpful tips that can, come in handy. We want it to be an informal process, but we also just want to let you know how we see things going throughout this discussion. Basically, Janet will speak first. She will speak about her experience as a rare disease patient, and she will also talk a little bit about CAPA. I will then speak and talk about my experience as a rare disease patient, my challenges, and talk about things or experiences that have helped me to navigate these challenges. I will also touch on maybe some organizations, namely CORD, the Canadian Organization of Rare Diseases, but also other groups that are outside of Canada. And basically, those are organizations people can turn to for information, support, or any contribution they may make. So Janet and I will start the ball rolling, and then really it'll be more of an open forum for you to share if you want to. You can share through the chat, again, at the bottom of your screen, whatever you feel comfortable sharing. For example, when you were diagnosed, what you were diagnosed with. You can also share in the chat what topics you would like covered during the open forum. And at that time, we'll be providing or offering an opportunity for you to speak. You'll just have to raise your hand, which is at the bottom screen under the React icon, and we will address you at that time and give you an opportunity to speak if you'd like. So this is a safe space. We hope it will be an engaging process and a forum where you all feel very comfortable in sharing your thoughts and ideas. So Janet, I'm going to turn it over to you.
Okay, thanks, Natalie. If you have any questions, you could put them in the chat or wait and raise your hand at the end. Either way works for us. It took me 8 to 10 years to get a proper diagnosis. I'll start by saying my diagnosis is a small vessel vasculitis, probably GPA, so I'll get to that. It took 8 to 10 years to get that diagnosis. According to the Canadian Order of Rare Disorders, it takes an average of 7 years for a lot of people to get a diagnosis, so I guess I'm not far off that mark. Before I was diagnosed, I ended up with 3 sinus surgeries and 7 years of infection and a lot of ear problems and tubes, which actually, in hindsight, probably was the beginning of the vasculitis, but my doctors didn't catch on, and neither did I. At first, I started feeling pain in my calf when I walked, and I used to do a fair bit of walking, and generally joint pain and muscle pain all over. So for 4 years, I'd been to many doctors. And the last 4 years before I was diagnosed, they thought I had lupus. They were wrong. I didn't. I saw 8 to 10 different types of specialists, and that's honestly not an exaggeration. I remember saying to one of them, I'm tired of seeing men in white coats. He laughed and said, I'll bet you are, and sent me to yet another man in a white coat. So another mistake I made was going to the public library and getting books on lupus because there, wasn't a whole lot on the internet back in 1999 when I was diagnosed, and those books were terribly out of date. So the information in them really scared me and was flat out wrong. So 3 different specialists at the University Hospital in Saskatoon were working together, and they really did try hard to get me diagnosed. It's not that they weren't trying. My first rheumatology appointment was 2 hours long. I couldn't believe that. But they couldn't figure it out, and they were actually getting ready to write a letter to the government to try and send me to the Mayo Clinic to get a diagnosis. But the rheumatologist said he wanted to send me to a second rheumatologist for a second opinion. So he sent me to a rheumatologist in Edmonton. And at that point, my blood test started to show a lot worse, and I definitely felt a lot worse. So I'd never been this assertive with a doctor before, and I'd only met the guy once, but I picked up the phone, and of course I didn't have access to my blood tests then. That's long before e-health, and flat out said to him, something has to have shown up. Things are getting much worse. And meanwhile, I'm still trying to teach through all this. And he said, a matter of fact, it has. You need to get a biopsy of your calf muscle. And he said to me, I think it's vasculitis or myositis. And I'd never heard either one of those before. I actually was so sick of hearing different diseases, I didn't look those two up, which is kind of ironic because it should have, I guess. So I was diagnosed with granular ptosis of polyandritis. It's a small vessel vasculitis. The biopsy actually just said small vessel vasculitis, but for my other symptoms, we're pretty sure that's what it is, except that I'm lucky it didn't affect my organs, which it often can. There are about 26 different types of vasculitis, and they're usually categorized by the size of the vessel that's affected. So small vessel, large vessel. Now they do have different names, like Behçet's and so on. So I'm not going to take time to go through all 26, and frankly, I don't think I have them memorized. I'm lucky that mine was very mild compared to other people. I did go to a conference in the States on my own dime, and I met people who'd lost their hearing, who'd had strokes, who had kidney damage. It was just, it really hit home how mild mine was when I went there and met these people. So there's several different types of vasculitis. Like I said, it's a rare autoimmune disease that causes inflammation of the blood vessels, arteries, veins, or capillaries. And when the inflammation occurs, it changes the walls and the lining of the blood vessel and can cause weakening or narrowing. It also can result in organ and tissue damage, which can even lead to death. I remember feeling very scared and alone when I first found out I had vasculitis. I'd never heard of it, like I said. It wasn't until 8 years after my diagnosis that I ever met anybody else with it. At the time of my diagnosis, I was very sick, and I first took 3 months off of teaching, naively thinking I could get better and go back to teaching. I think my rheumatologist knew at the time I wouldn't be, but I think he was trying to wait for me to figure it out. I really struggled with the loss of my teaching career. The treatments was high-dose prednisone and methotrexate. Now there's a lot of other drugs available. At the time, there were not biologics and so on. Methotrexate is usually given with most autoimmune diseases. I was in and out of hospital a lot for really strange reasons, like really messed up balance because of my ear problems. Eye pain, that is a whole other problem I'm not going to get into, was related to the vasculitis. It was just really weird things. My GP, when he heard I had it, was very honest with me, and he said he knew what it was, but he'd never treated a patient with vasculitis. And I really did appreciate his honesty, because he's not afraid to say when he doesn't know something. I could tell, though, that later on he had done some research and learned about it. I had tests on my heart and my lungs. I do think it was affecting my lungs at the beginning, but was brought under control by the medication. That took a lot of time, though. Had to have regular blood work. I think it was every 3 weeks. I was on high doses of prednisone, and I was put on medication to protect my bones. So everything was done correctly, but I still ended up with 3 broken bones during the 8 years I was on prednisone. And of course, that was pretty frustrating. It took probably 8 or 9 years for the vasculitis to stabilize. I haven't been in the hospital for probably 10 or 15 years. I don't miss the hospital. So obviously I'm happy about that. Once things started to stabilize, I kind of felt like I needed a purpose. I was rambling around the house alone by myself, not doing much. So I started off by volunteering with the Arthritis Society, and then with the Canadian Arthritis Network, and with the Canadian Arthritis Patient Alliance. And I had no idea how that was going to snowball. And I'm not going to get into all the things I did. But now I volunteer with several different groups, and I'm on several different knowledge synthesis programs and do a lot of grant reviews for groups. I didn't plan for this, but each opportunity kind of presented itself and opened a new door. And I've got to say that I have enjoyed working with these groups, and I've met some really interesting people that are, consider friends. Like Natalie, I ended up developing several other autoimmune diseases, which is common. I'm not going to get into those. The challenges I faced were obviously the time getting diagnosed. I can't help but wonder if I was diagnosed sooner, whether it could have been controlled earlier and better. I actually don't live right in North Battleford. I live 45 miles from it. So for me to go to an appointment in Saskatoon is 2.5 hours. So traveling to and from appointments from a rural area is tough. I'd have to miss a whole day of school for one appointment. I was finding it more difficult to teach, like I said. So I really did struggle with losing that. It's also very kind of lonely and difficult when you have a disease that other people don't understand. You don't, like they try to, but and somebody would say, "What do you have?" And I'd say vasculitis, and 10 minutes later they'd ask me again what I had, because of course they've never heard of it. Some of the lessons I've learned is try and learn about your condition. I'll caution you to be careful where you learn, which I'll get into a little bit later. Give yourself some time to adjust. Don't isolate yourself. Try not to be a victim. Find a support person or people, and that does not have to be somebody with the disease you have. One of my support people doesn't have arthritis at all. She's a friend here in town that has a really wicked sense of humor. So it doesn't have to be somebody that totally understands what's going on with you. Try and do things that are fun. Try and find something purposeful. In my case, it happened to be medically related. I didn't plan that, but it does not have to be related to your disease. One thing I also did that's not related to my disease is I joined a band and played with them for 10 years until they ended up folding at COVID. But we used to do a lot of concerts around Battleford, met once a week to practice. So that was something fun for me because it had nothing to do with medical, and I have a background with playing the clarinet, so I really did enjoy that. Go out with friends if you can. Try to stay positive, and I know that's easier said than done. A person has to accept their new normal, which again is easier said than done. I have a saying up in my computer room that I've had up all these years. I still love it. It says, "Life is not about waiting for the storm to pass. It's learning to dance in the rain." And that saying kind of says a lot. My advice is to be careful about following online groups on Facebook and so on. You need to go to trusted sites like the Canadian Vasculitis Foundation, which I think Natalie will get into. I've seen some Facebook groups that I don't know who runs them. If it's not run by, a vasculitis foundation or whatever, I've seen some pretty sketchy medical advice that shouldn't be given. So be careful where you get your information. As I said, I'm on the steering committee for the Canadian Arthritis Patient Alliance, and I represent CAPA, which is our acronym for the Canadian Arthritis Patient Alliance, with the Canadian Order of Rare Disorder. CAPA is a virtual organization. It's a grassroots patient organization that exists virtually. I'll put the link in when Natalie's talking, I guess, sorry. And our purpose is to raise awareness about arthritis and to ensure timely and uniform access to the appropriate medications and healthcare professionals and services. CAPA's done a lot for access to the proper medications, especially new medications, to ensure a meaningful voice in arthritis research for all decision makers making levels, and to develop a strategy to increase awareness in policy planning and development, to create a source of information for adults and children. And yes, children do get arthritis. And arthritis, juvenile idiopathic arthritis, is actually considered a rare disease. I was surprised to find that out. We also want to assist children and adults in obtaining access to care, reimbursement for other services, and to cope with disability and prevent pain. Things we do are partnering in research. Right now, I'm working on a research project to do with arthritis and air pollution. We advocate, like I said, for different medications, create resources. I encourage you to go to the website. I see Natalie's done my job for me and put the link in there. Our webinars are recorded there and put onto the YouTube channel. We have a newsletter, which I'd recommend signing up for. It goes, which is Canadian right here. Natalie's got that in the chat, and the Canadian Arthritis Patient Alliance. We do have a scientific advisory committee that does check our work before we put it out. We do work with them. So what you see there has been vetted. And I'll turn it over to Natalie to tell you her story and to explain what CORD is.
Thank you. Thank you, Janet, for your story. A lot of things that you mentioned kind of resonate, obviously, with me. The amount of specialists you saw, the number of years it took you to get diagnosed. So basically, I'm going to start by telling you what I did before. I was a prosecutor. So I prosecuted criminal matters in court pretty well every day. Sometimes we had several trials dealing with witnesses, police officers. It was high stress, high action, but it was a career that I loved. I was also very active. I was a golfer, a skier, cross country, downhill, a hiker. I was always on the go. I also was involved in the community. I was a board member for various organizations. So just a busy woman. I was a mom as well. At the time, I had a teenager and married as well. And we had just built our home. We had just built the home where we were supposed to eventually retire. And I was living in Sudbury in Northern Ontario at the time. So I was 46 when my husband noticed I had this chronic cough. I ignored it, obviously, too busy to deal with that anyway. So it just kept getting progressively worse. I noticed voice changes. I was dealing with voice hoarseness. I loved to sing, and I noticed that I couldn't hit notes anymore when I was singing. That progressed to breathlessness because we were running from court to court, literally running with files and big briefcases. I was taking the stairs because the elevator was too slow. And I would notice that I kept saying, I'm really out of shape. I was breathless all the time. And especially when I was walking and talking at the same time, which we did a lot. So I, again, really didn't go for help until I saw blood in my sputum. And that's when I knew that things were not good. So same kind of challenges in the sense that it took me a while to find the initial cause of what was going on. CT scans were normal, blood work normal, same story. And finally, I was able to find a specialist in Newmarket who took a look in my windpipe. And that's when he saw the narrowing just under my vocal cords. I had something called subglottic stenosis. And that can be idiopathic, where you have no known cause. And they did take a biopsy and didn't find anything. So I was diagnosed with idiopathic subglottic stenosis and had to get tracheal dilations. And I had several of those during the course of the years until I was diagnosed with small vessel vasculitis like Janet, because I did have clinical signs and symptoms that matched vasculitis. The symptoms kept changing and progressing. Even though I was on immunosuppressants, I then developed the ear swelling, the outer ear swelling, and it was very painful. I couldn't sleep on my ears. I couldn't sleep on the side at all. And as they would come and go, I started developing erythromelalgia, which is the swelling and painful hands and feet. So it just kept changing. And eventually I saw a specialist in Ottawa, which is where I live now, in 2018, that said that this fit more relapsing polychondritis, but we never did remove the vasculitis diagnosis. So I have a dual diagnosis. Um, in any event, I faced again the same challenges that Janet did. First of all, the unavailability of specialists. I was traveling from Sudbury to Toronto, which was a 4.5 hour drive initially. Um, for the first 3 years of experiencing these symptoms and the first 3 years of the disease, I tried to keep working. And it became pretty clear to me that I felt I was okay sometimes, and I'd say, okay, I'm back at work, I'm good now. But only to fall apart within a couple of weeks to a month, just because it was so difficult to deal with the workload and the stress of the job. Um, it was devastating to lose my career as a prosecutor. It was something I loved. So obviously I went through a grieving process. As well, my social life, same thing as Janet mentioned, it's very isolating. I went from being an extrovert to an introvert. You just basically, you make plans, and I always did keep making plans, but had to break a lot of plans as well. As well, medication adjustments is something that I really didn't expect as a rare disease patient. You know, you think you're talking to the doctor, they say, we'll put you on these meds, but they don't really prepare you for the journey that you're going to be on. And it is a bit of a roller coaster because you start these meds thinking they're going to help, and then they have to adjust the doses. And, you know, it keeps changing. I think I can't even count how many medications I've tried. And now I'm on a biologic. And even when I was put on the biologic, they had to change the dosage quite a bit. And finally, I feel I'm at the most stable point. It is not remission. I do have symptoms, but they are more controlled, not as intense, not as frequent. Um, Tips. Basically, for me, I was bombarded at the beginning with how much I couldn't do. I couldn't work. I couldn't just make plans. I felt overwhelmed with the amount of things that were, you know, just falling out of my life. I was devastated. And I had to I did some counseling, which helped, but I had to switch or flip the switch and figure out what I could do. So I started setting very small goals. The first thing was figuring out I couldn't do my job. So that gave me the time to try and heal and try and live with this somehow. So I would get up in the morning and say, well, today I'm going to have a shower, and I'm going to make myself a soup. Those were manageable goals some days. And other days it was something a bit more. I'm going to go out today. I'm going to go to the grocery store. And you just have to just put those achievable goals, and they will get better. It will get better in the sense that once you're able to find the right medication and the right dosage, more goals become more achievable. What helped me as well was Janet touched upon the social media groups. And yes, we do have to be careful. There's so many bots now, and so many fake accounts. We really have to be careful with those. But I did get a lot of useful information from these groups, and also by joining other groups. She touched on CAPA. Canadian Organization for Rare Disorders. CORD is another one that I became a member. I had been a member early on, and I kind of fell out of it because, again, you're dealing with your disease, and sometimes that's just overwhelming, but I'm just recently back in it. So basically, it is an advocacy group that promotes and seeks health policy, healthcare system that works for those with rare disorders. And just going to minimize this. So basically, they work with experts in every sector. They've developed a rare disease strategy which details the challenges faced by rare disease patients, including misdiagnosis, unnecessary surgeries, isolation, financial hardship, lack of treatment options, and early death. The membership cost is not overly onerous. It's $25, but it gives you access and priority access to conferences and development sessions, forums, You can get information on up-to-date policy changes in healthcare, participate in the meetings. The next CORD meeting is actually April 29th and 30th in Calgary. So there are scholarships available for those who would like to attend virtually or in person. And they basically played a big hand in advocating for a rare disease strategy and having the federal government adopt a national strategy for drugs and rare diseases, which is a good amount of money, 1.5 billion over 3 years. And that came into was put in place in 2023. And they were able to get bilateral funding agreements for certain rare disease drugs with different provinces. And I think almost everyone has signed on. I believe Quebec was working on it this week. And the only two provinces or two maritime provinces, PEI, I believe, and Nova Scotia, I believe, are still we're still hoping that they will get in on the agreement. So Orphanet is one where you can type in, if you go into inventory and classification of your disease, for example, mine is relapsing polychondritis. And you find your disease, it then gives you a definition, but also it gives you articles, guidelines, and further information. So you have patient-centered resources for that disease, the research projects, and this is all over the world, which is so helpful. Some people, including myself, feel like you want to be doing something productive if you're able to. You want to be part of a study, or you just want to get more involved. Those are things that you can do. Another one that is popular is the National Organization for Rare Disorders. This is another one that you can get involved in. The links can be shared, hopefully either by Anna or myself during the forum. We'll be able to share those. And there was a couple more that I wanted to talk about. Let's see if it's this one. Yeah. Vasculitis Foundation. This is one that is, I believe, based in the States, but it is the Vasculitis Patient Powered Research Network. So they really count on patient data to help them research. And so I think I update it every 3 or 4 months. It takes me 5 to 10 minutes, and it really helps experts and researchers in the area in those diseases to just keep studying and offering more options. Being a patient partner in research is something that I do through CAPA. So basically you are providing researchers with firsthand experience. Also, the other thing that I have done is become a patient advisor through my local teaching hospital here at Ottawa, at the Ottawa Hospital. Now, we're at the point where I think I'd like to open it up. I see that we have some links that have been shared. Thank you, Anna, for doing that.
Natalie,
And
can I jump in with
yep.
one thing before you do that I should have not realized with Kappa? If you look at our resources, like there's a page on methotrexate tips and tricks, and it may refer to rheumatoid arthritis, but really the information does apply to other forms of arthritis too. So, what's there listed is, of vaccines for rheumatoid arthritis or methotrexate. It's still the same information is beneficial to other forms of arthritis. So don't get frustrated with just that. That just happens to be where the research was done. And of course, that's where most of the research is done, but it really does work for other, same advice for other forms.
All right, thank you for pointing that out, Janet. All right, well, thank you for joining us, and we hope to chat again.